Hi, we have Dr. Lori here at Warwick Chiropractic. I'm Dr. Warwick, and I'm going to be working on Lori. Dr. Lori, excuse me, she has some neck and mid back pain. Anything down in the lower back?
Some kind of SI joint, hip, yeah.
Okay, you had a history of motor vehicle collisions?
2 motor vehicle accidents, one in 2001, 2002-ish, and one in 2008.
So it's nice to see practitioners also going to each other to get good care. So let's have you go face down for me. And I haven't seen you in a little bit, so what did you like about the treatment that you had the first time?
It was gentle, it was really specific. I felt like it lasted a lot longer than typical chiropractic adjustments. So like a typical adjustment may last me a few days to a week, where I felt like yours lasted 2 to 3 weeks, just even like from one adjustment.
And you haven't had any injuries though since, have you? Okay. Okay, so you're about 3/4 of an inch short on the right side. Go shorter in position 2, and I'm getting a locking effect. So we have a little bit on the left SI joint and sacrum right there. Okay, try raising this leg for me. Back down, and try this one. Back down. Did this one feel what I'd say is a little sluggish or more difficult when you were raising, or do they feel about the same?
Yeah, now that I'm laying here, I have quite a bit of pain on the left side.
Right there.
Right there.
May want to change your mind about being gentle. Lay on this side. So I took you through a lot of the activator protocol
Yes.
last time, didn't I?
Yes.
And just let your body roll into me. So take your right hip and push it into my hand. That's it. And release it. Good. And go face down. So we didn't get a lot of movement on the sacrum there, but we did get a change in the leg length. Both are moving now. So we're going to contact the SI joints right here. You'll feel the table drop. Left side, and we call that a left AS because of how the position of the pelvis goes. And now you're going to feel how much further the knees are bending. We still have more to go yet. Okay, as soon as I push the sacrum that direction, your leg went about 1 inch to 1.25 inches short on the right side. So now we're going to bring it back down this way. You doing okay?
Mm-hmm.
Good. All right, go ahead and put your right hand on the lower back for me. Keep it there. So we're testing L5, hand down. What we're using here is an activator instrument, adjusting right on the joint area of L5. Put your hand back there again, please. Rechecking L5. Okay, switch hands. L4. Right leg went short about 1/2 inch. And we're looking at about 3/4 inch that side, so take the hand away for me. L4, left side. Both hands on the lower back, please. Short and shorter. Hands down. Let's have you lay on your right side. You doing okay?
Yeah. Didn't realize how bad my low back was hurting.
Good. Face down. As soon as I adjusted that, both legs lightened up. They're a lot more, feel how more flexible they are.
Yeah.
Okay, both hands back there again. We're going to recheck L2. Okay, so L2, hands down for me. superior on the spinous. Take a deep breath, release. Deep breath in again, release. Is that a little too tight for you in that area? Because I can feel you bracing a little bit.
Yeah, it's a little stiff.
So sometimes when a patient has that kind of tightness, you want to try different techniques and connect with that person and see how they're doing with that. Because sometimes, I wouldn't say it's more harmful to them, but you want to find ways to help that patient, help that person receive the adjustment a little bit easier. There's many different styles to adjusting. Well, it's even good that the doctor takes care of herself. You okay with that?
I think it's awesome.
I'm going to add a little bit more pressure in there. If it's too much, let me know. Now, I remember last time, Doc, we adjusted the ankle. Didn't you have something going on with the ankle?
I
Or
think
was
it
it?
was locked up, but it's been feeling pretty good.
It's been better?
Yeah.
Did you have a soccer injury or something?
I have a bunion on my left foot, but it's been fine since I've been doing the prolo. It's actually been really good. I've been happy about that.
Good.
Because even now, if I feel it start being a little sore, it seems to get better, so. Like, pretty quickly. It just depends on the type of shoes I'm wearing. Seems like.
You wear comfortable shoes at work?
Yeah, the only shoes that still kind of bother me are my hiking boots. I have to get some new hiking boots. But other than that, I pretty much got my shoes figured out.
When some people have lower back tension or lower back pain, one of the techniques that I use in here is this flexion distraction. It's a way of tractioning the lower back, opening up the area where the joints are, as well as helping hydrate some of the disc area by creating some motion at that area. So right where I'm contacting now, down in her lower back, a lot of tension in there. I had to adjust both sides of the lower back. She probably sits on one side more than the other when she's with her patients. Do you sit facing your people?
I actually stand at work.
You're standing most of the time?
Yeah, I have a podium that I stand at.
Okay.
I stopped sitting about 6 months into my practice because I really felt bad my low back was hurting.
Yeah. Too much sitting, worst thing that you can do.
Yeah. The only time I sit is when I'm charting occasionally. Doing other stuff.
Like when you're doing the injections?
Like after work?
Okay.
Yeah. Like when I needed to have been standing all day.
Oh, I felt this release through here.
Yeah.
You doing okay with the pressure?
Yeah, it's great. I don't think you used this on me last time.
Oh, I do so many different styles.
It's pretty cool.
When people have scoliosis or any disc issues, this is what I use.
This is great.
Not the only thing, but when, so if I could feel like if there's some disc areas where the disc is sitting on like medial or lateral to the side, I can change and move the positioning of the table back and forth like this. Opening up the facets. In fact, you just get a nice little release with the lower back right there. It's good you came in.
Yeah.
Way too long, and then the vehicle needs the 50K tune-up.
Right.
Lay on your back.